Okay, good morning. This is the cranium. Now, today we'll study the cranium of the skull, the cranium bone or the skull of your this skeletal system. Now, as we have seen this various the bones of frontal bone, the parietal sphenoid bones, the maxilla, the mandible bone, the parietal bones, the lateral bones, the temporal bones, and the occipital, the backbone. Now, next is we'll start with the the superior and the lateral view of the skull. Now, the superior view is consists of you can see the zygomatic arch is formed by the zygomatic process of the temporal bone and the temporal process of the zygomatic bone. This forms the zygomatic arch. Okay. Now, here in the superior view, you can see the various sutures of the temporal bone. The various sutures are which are present here are the frontal bone, and there is the coronal suture which is connecting the frontal bone and the both the parietal bone. There is the coronal suture. Now there is sagittal suture which connects the both the parietal bones to each other is the sagittal suture, whereas the various bones which are which connects the so this parietal bone to the occipital bone is the with the help of sutural bones they connects to the occipital bone is the lambdoid suture which connects the parietal bone, the sutural bones and the occipital bone is the lambdoid suture is at the back of the skull. There is lambdoid suture. Okay, now there is squamous suture at the side of the bones which connects the temporal and the parietal bone is the squamous suture which connects the side bones of your parietal and the temporal bones. Okay, these are the various sutures of the your skull bones. The superior view of your skull bone is these bones. Now next you can see is the lateral view of your skull. Okay, now if you see your skull from this side, how will look like? Okay, the various it is I've taken the colored pictures as you can differentiate the various bones from the sides so that you can find out the how they are situated, the various cranial bones and the facial bones, so that you can differentiate among yourself so that it is more understandable. Now you can see the blue colored frontal bone. Okay, the forehead bone is the frontal bone, then below that you can see the green colored side bone is the sphenoid bone. Okay, below that there is the zygomatic bone. You can see the zygomatic bone, and inside there is ethmoid bone inside the orbit. Okay, the orbital fossa is consists of the ethmoid bone. Then there is lacrimal bone inside the purple bone, the lacrimal bone. Okay, which contains the lacrimal fossa. Okay, now there is the nasal bone, the frontal, the two nasal bones you can say from the side. This nasal bone. Then there is temporal bone, the temporal process. Okay, temporal process is the temporal process of zygomatic bone, and the zygomatic process of the temporal bone forms the zygomatic arch. The lateral arch of your face is the zygomatic arch. So there is a temporal process. Now there is mandibular fossa. You can see the mandibular fossa down. Then there is maxilla and the articular tubercle in the your zygomatic arch. There is articular tubercle. Then there is mandible down. Okay, maxilla up. The upper jaw is formed by the maxilla and the lower jaw is formed by the mandible. Okay, now you can see the various this coronal suture. You can see we have already seen in superior view the coronal suture. Now there is parietal bone. Behind the coronal sutures, the two bones, the parietal and the occipital, these two bones connect and to form the coronal suture. They are connected to the coronal suture. Now the parietal bone, there is temporal squama. Okay, the temporal formed by the temporal bone. Now there is a squamous suture at the side. There is squamous suture, the zygomatic process of the temporal bone, the lambdoid suture, the mastoid portion of occipital bone. Okay, now the external occipital protuberance. You can see external occipital protuberance. Okay, at the back. Okay, lambdoid suture connecting the parietal and the occipital bone. Okay, mastoid portion is the mastoid portion. Mastoid process is also there. You can feel below your ears the mastoid process, the hard process, and then there is external auditory meatus. Okay, which forms the external ear, the external auditory meatus. Okay, now there is mastoid process which forms the and there is a styloid process, and there is occipital condyle of the portion of your occipital bone is your occipital condyle. Okay, now there is the next is your internal view of your this sagittal view, the internal view of your bone, your cranium. How, if you divide the cranium into two, how it will look like from inside. Okay, now this is the internal view of your cranium when you divide the cranium into right and left half. Okay, now it contains the hyoid bone is also shown in this picture, but it is not the part of cranium, but it is shown here. Okay, the cranial bones are the frontal, parietal, temporal, occipital, sphenoid and ethmoid bones. These 6 bones are the cranial bones: the frontal, the 2 parietal, the 2 temporals, and 1 occipital, the 2 sphenoid bones and the 2 ethmoid bones. These are the cranial bones. And the facial bones are the nasal bones, maxillae, zygomatic bones, lacrimal bones, palatine bones, inferior nasal conchae, and the mandible and vomer. These are the facial bones. Okay, these are the various facial bones and the various cranial bones. Okay, now the frontal bone. Now the frontal bone, there is coronal suture. We have already gone to that. The how you can see the various internal bones. See, below the frontal bone there is written sella turcica, dorsum celli. These are the various parts of your sphenoid bones. Okay, the tuberculum celli, the hypophyseal fossa. These are the various small portion of your these are the various small parts of your sphenoid bones. Okay, now there is frontal sinus, various sinuses present which contain the air-filled cavities, frontal sinus which are present here. Okay, now there is hypophyseal ethmoid bone, cristagalli, cribriform plate, perpendicular plate, nasal bone. The ethmoid bone consists of the cristagalli, cribriform plate, perpendicular plate, which forms the ethmoid bone. These are the present in the ethmoid bone. Now there is the nasal bone, which on which the nose is present, is the nasal bone. Okay, now there is sphenoidal sinus. You can see at the side the sphenoidal sinus. Okay, the sphenoid bone at the side, the inferior nasal concha is present here. Then there is vomer. Okay, vomer. Then there is maxilla at the upper jaw. Okay, the palatine bone. and the mandible. These are present in the front of your frontal facial bones. Okay, when you divide the cranium into two. Now the next is the when you see the back of your this cranium, then you can see the parietal bone you are seeing. Okay, now temporal squama, the squamous suture connecting the temporal and the parietal bone, the lambdoid suture connecting the connecting the parietal and the occipital bone. Okay, through sutural bones is the lambdoid suture. And there is a temporal bone connecting the there's temporal bone. There is contains the internal auditory meatus. Okay, it contains the internal auditory meatus. Okay, then there is you can say external occipital protuberance is also present at the back of your this occipital bone. There is external occipital protuberance. Then there is mastoid portion, then occipital bone, then hypoglossal canal through which the hypoglossal nerve, the cranial nerve passes, the hypoglossal nerve, the hypoglossal canal. Then there is occipital condyle. Okay, then there is styloid process and the pterygoid process and mandibular foramen. These are the, you can see from back, there is various things which are present. These are the various structures which are present. Say mandibular foramen in the mandible, the pterygoid process, styloid process in the occipital condyle. These are present in the back. Now this is again the middle when you divide the cranium into two, and the hyoid bone at the below the mandible, you can see this is present in the neck. Now see from back the posterior view. If you see the posterior view, how it will look like. The posterior view of the skull is, the sutures are exaggerated for the emphasis. You can see the posterior sutures here. Okay, now they sutures are which are present. You can see the sagittal suture between the two parietal bones. Okay, then there is sutural bones which are connecting the parietal bones and the occipital bone and forming the lambdoid suture. Okay, now there is external occipital protuberance. There is external occipital protuberance. Then there is temporal bone, side lateral bone above your ears are the temporal bones. Then there is mastoid process. You can see from back the mastoid process. Okay, the styloid process and occipital condyle, the border of the foramen magnum. The occipital forms the border of the foramen magnum. Okay, from if you see from right side, you can see the parietal bone, sutural bones, lambdoid suture. Then there is superior nuchal line. The superior nuchal line is the inferior nuchal line. This foramen magnum through which the spinal cord passes. Okay, now there is inferior nasal concha is present. Inferior nasal concha, the heart palate, horizontal plate of the palatine bone is the heart palate, and the palatine process of the maxilla is present. Okay, now these are the various processes. Vomer bone, the mandible, these are the various processes. The mandible is the lower jaw. It forms the lower jaw which contains the spaces for your tooth. Now so this is the, if you see the cranium from back, it will look like this. Okay, so various sutures and the various foramens from you can see from the back. Now from the inferior, inferior view, if you rotate the skull upside down, then how it will look like. The various foramens, the base of the skull is very irregular. It contains lots of processes, lots of foramens, lots of spikes, lots of bones. The irregular bones is present to occupy the various portion of your brain, the various coverings of brain and your various parts of your brain. Okay, so from inside, this is the look from outside actually. Okay, this is the inferior lower jaw bone is removed in this, so that you can see properly the inferior view of skull. Okay, now the inferior view you can see from right. You can see the incisor teeth you are seeing at the front, the incisor teeth. Okay, maxilla, the incisive foramen, the palatine process, the zygomatic bone, palatine bone. Okay, these are the various bones which are present. Okay, now there is inferior nasal concha, this pterygoid processes. Okay, the pterygoid processes are there. Then there is articular tubercle, then there is foramen lacerum. The various numbers of foramens are present here in cranium. One is the foramen lacerum, then styloid process, then there is external auditory meatus. We have seen in the lateral view also the external auditory meatus. Then stylomastoid foramen is also there. There is number of foramens, and since there is number of foramens which are present for the number of arteries, veins, cranial nerves which passes through these foramens to enter the brain, to leave the brain. So these are the various foramens which are present here in the base of the skull. Okay, now there is mastoid process. In sideways you can see the mastoid process. There is foramen magnum. This is the largest foramen through which the spinal cord passes from the brain to the your backbone, your vertebral column. This is the foramen. This whole, this circle, this space, this hole is called as the foramen magnum. Okay, now there is below you can see is the mastoid foramen. Okay, in the temporal bone. Then there is parietal bone, lambdoid suture at the back connecting the occipital and the parietal bones. Then you can see the external occipital protrusions. Okay, so these are the various sutures which are present. Now the superior nuchal line, inferior nuchal line, you can see. Okay, now there is vomer from zygomatic arch. You are seeing the various processes of zygomatic bone, and the temporal bone forms the zygomatic arch. The vomer, the sphenoid bone, the foramen ovale, foramen spinosum. You need not to remember or learn all the foramens, just you need to understand that these are the various foramens which should be present in the skull. Okay, mandibular fossa, there is carotid foramen, there is jugular foramen, the occipital condyle, various just like carotid foramen for your carotid arteries and veins. There is occipital condyle, jugular foramen for your jugular veins and arteries. Then there is occipital condyle also present, which articulate with the your atlas of your the fourth cervical vertebra atlas. So there is the occipital condyles are there. Okay, and below that there is temporal occipital bone, and the inferior nuchal line is superior nuchal line. So this is the inferior view of your skull, the base of the skull. Yes. Okay, now next is the inside. How your inside will look like when you see the sphenoid bone. Okay, the sphenoid bone, you can see the sphenoid bone is called as keystone of the cranial floor because it articulates with all the cranial bones, holding them together. See, this sphenoid bone connects all your different bones. It is connecting to frontal also, to parietal also, to temporal also, to occipital bone also. So this is the basic floor. It made up of your sphenoid bone. This is the basic bone of your cranium, okay, which makes the floor of your cranium. Okay, now see in this picture you can see the frontal bone, ethmoid bone, in which is there is a cister, gully, olfactory foramen, and the cribriform plate. Then sphenoid bone, the various wings, the lesser wing, tuberculum celli, the hypophyseal fossa, the dorsum celli. These are the various, in the name they've given the name to the various parts of the bone. Okay, here these are the various part of your bone. Now see there is foramen lesserum, the squamous suture, okay, connecting the parietal and temporal bone. Then there is temporal bone, the petrous portion, internal auditory meatus, jugular foramen, okay, jugular foramen. Then there is parietal bone and the lambdoid suture connecting the parietal and the occipital bone. Then there is in this view you can see the coronal suture, okay, the superior orbital fissure, the foramen rotundum, the foramen oval, the foramen spinosum, the various numbers of foramen present for the various structures to pass and to come into the cranium. Okay, now there is hypoglossal canal, the foramen magnum, and the occipital bone is shown in the various structures. See, this is the view to your sphenoid bone. See, it's look like this. If you see from front, it will look like this sphenoid bone. Frontal view of this sphenoid bone is look like this. There are lesser wings, there are greater wings. There is optic foramen, sphenoid sinus in the body, foramen rotundum, the superior occipital fissure. There is body of this sphenoid bone and the pterygoid processes. The pterygoid processes, the body, the superior orbital fissure, greater wings, lesser wings. These are the parts of your this ethmoid bone, this sphenoid bone. Now see the ethmoid bone. How your ethmoid bone is seen. Okay, now see. You see here. The ethmoid bone forms part of anterior portion of the cranial floor, medial wall of the orbits, the superior portions of the nasal septum, most of the side of the walls of the nasal cavity. The ethmoid bone forms the anterior portion of the cranial floor, the medial wall of the orbits, the superior portion of the nasal septum, and the most of the side walls of your nasal cavity is formed by the ethmoid bone. Now, it's various things which are present in the ethmoid bones are there. First, you can see the frontal sinus. Okay, ethmoid bone is there is crista galli, olfactory foramen, the cribriform plate, the superior nasal concha, the middle nasal concha. Okay, these are the various the inferior nasal concha, palatine bone, and the maxilla. You can see the sphenoidal sinus. Okay, this is the ethmoid bone of your skull. Now you can see here in the posteriorly, if you see this posterior view of your ethmoid bone, it will look like this. The anterior view and the posterior view. First you can see the anterior view, how it will look like. So it is right orbit, left orbit. Okay, there is vomer, the crista galli up, the lateral mass, the perpendicular plate, the middle nasal concha, and the inferior nasal concha. These are the various present structures of your this. Now here you can see posteriorly. If you see it from posterior view, it will look like this. This is the posterior view. It's a superior view rather, and the superior view and the inferior view is like this in the various things which are present in this concha and the ethmoid bone. The olfactory foramen, ethmoidal cells of ethmoidal sinus. Okay, now there is lateral mass, there is cupriform plate, there is crista galli, and the perpendicular plate. This is the superior view of your ethmoidal bone, and the interior view is look like this. Crista galli, ethmoidal cells of the ethmoid sinus, lateral mass, superior nasal concha, middle nasal concha, perpendicular plate. These are the various plates of your ethmoidal bone. Now see the mandible. This is also very important part of your cranium. See, of your facial bone, the mandible, the lower jaw. Okay, the mandible is the largest, the strongest facial bone. Okay, see, it has the coronoid process. Okay, one process called as the coronoid process, and one is called as the condylar process, which articulates with the temporal and bone and form the temporomandibular joint. Okay, there is mandibular notch present here is the mandibular notch. Okay, the ramus of mandible, okay, the angle and the body. These are the various parts of your mandible. The condylar process, the mandibular notch up, and the ramus, angle, and the body of your. And the in front there is mandibular foramen. Okay, mental foramen is also called as mental foramen. The coronoid process, mandibular foramen. Inside there is mandibular foramen upside. This is called as mental foramen. And the alveolar processes for your teeth. It contains. This is the mandible. Okay. Now you can see this is the various bones of your nasal septum. Okay. The structures that form the nasal septum are the perpendicular plate of the ethmoid bone, the vomer, and the septal cartilage. These are the various bones of your septal bone, the crista galli, the sphenoid bone, nasal septum, perpendicular plate. You can see the various detailed structure of your nasal bone, horizontal plate of the palatine bone, frontal bone, nasal bone, septal cartilage, palatine process of your maxilla. So this is the nasal bone. Now orbit. Okay, how your orbit will look like. The orbit is a pyramid shaped structure that contains the eyeball and the associated structures. How your orbit will look like frontal bone, supraorbital margin, supraorbital foramen. Okay, supraorbital margin, there is a supraorbital foramen inside this contains in the frontal bone. Okay, then there is sphenoid bone at the back, you can see. Okay, optic foramen or canal, optic foramen or canal, then superior optic orbital fissure, then there is palatine bone down, palatine bone, then there is inferior orbital fissure. Okay, and outside you can see the zygomatic bone and the infraorbital foramen. You can see here. Okay, so and the other view, you can see the supraorbital foramen, nasal bone. Okay, lacrimal bone. There is lacrimal fossa and there is maxilla. So these are the various structures of your orbit. How your orbit is formed of the various temporal, frontal, your sphenoidal, your maxilla bone, all together forms the orbital fossa, which contains the eyeball. Okay, now this is the chart for your various bones, the principal foramina of your skull and the various foramina of your what are their location and the which structures, because there is an n number of foramina are present in the skull. So this is the various foramen which present where and which their location and the structures which are passing through these foramens are like carotid foramen in the petrous formation located in the petrous portion of temporal bone. Internal carotid artery and sympathetic nerves passes through it. Okay, hypoglossal foramen present in the superior to the base of, we have read all these foramens, we have seen where they are present in the various portion of your brain. And what are the structures which passes through these foramen? The cranial nerve passes through the hypoglossal foramen, the cranial nerve 12th hypoglossal nerve. Okay, branch of ascending pharyngeal arteries also passes through this hypoglossal foramen. Now there is intraorbital, inferior to the orbit is the maxilla infraorbital foramen. The various structures like intraorbital nerve, blood vessels, branch of maxillary division, cranial nerve, jugular foramen, interjugular veins, cranial nerves 9 and 10 and 11, then lecrum, blecerum passes, branch of ascending pharyngeal artery, then foramen magnum. It's a very important occipital bone present on medulla oblongata and its membranes like meninges, cranial nerve 11, the accessory spinal and the vertebral and the spinal arteries. These all passes through the magnum, foramen magnum. Mandibular foramen, inferior alveolar nerve, blood vessel, mastoid process, mastoid foramen. Then there is mental foramen, the mental nerve and vessels. Olfactory foramen, olfactory foramen is the cranial nerve, olfactory nerve 1. The optic foramen, the cranial nerve 2, the optic nerve. Okay, the ophthalmic artery also passes through the optic foramen. Then is foramen ovale with mandibular branch of cranial nerve 5, the trigeminal, okay, mandibular branch, and the rotundum foramen, the maxillary branch of cranial nerve 5. Okay, now the stylomastoid foramen, this cranial nerve 7, the facial nerve passes through the stylomastoid foramen and the artery of the stylomastoid artery also passes through the stylomastoid foramen. Now there is supraorbital nerve and artery which also passes through the supraorbital foramen. Okay, these are the various foramens and the various structures where they are located and where they are what are the structures which passes through the foramen.